let's have a look at this particular one. Right, so this is a pediatric x-ray. Hopefully someone can tell me what they think is going on. So just throw an answer out there. I'll give you like, I don't know, 10 seconds, right? Just have a quick look. Yeah, exactly. So exactly what I thought would happen, that what can happen is that because when you get, so in FRCR, right, what ends up happening is as soon as you put a pediatric, so FRCR, for some of you, if you don't know, is the professional exams for UK radiologists or radiologists to become part of the RCR of UK, the Royal College of Radiologists, become a fellow. And so what can happen is that, like, as soon as you put pediatric x-ray, people will say it's going to be a slipped femoral epiphysis straight away, right? And yeah, you're not wrong. You're not wrong. I mean, it can be, right? But when you've got those sort of situations, they're kind of a more chronic thing that happens over time, and you get sort of a slow slip. And you're not incorrect by any means by saying that this could be a slipped femoral epiphysis. And the risk for a slipped femoral epiphysis is that you can get eventual avascular necrosis of the femoral head. So, I mean, hopefully everyone has seen that this area, sorry, does not look quite right compared to the other side. So look, that looks nicely aligned. Compared to this one, it doesn't look quite so nicely aligned, right? And yeah, you're right, it has slipped. You're completely right, it has slipped. So this does slip like this. But this is not like an insidious slip. It's not a slip that has taken a while to happen, because if you look, remember how I said, look at the trabeculation? You can see that the trabeculation of this all kind of curves. Can you see that? It kind of all curves this way, all curves this way. So pediatric bones are very, very soft, like I was saying earlier. You know, when I got that wire, where's that wire gone? I normally have wires everywhere, but you can see that wire, right? They're very, very soft sort of bones, right? So when you get sort of slip femoral epiphysis, there's no reason for the cortex to kind of slip like that as well. You get increased sclerosis, you can get avascular necrosis over time. But when you've got that sort of abnormal appearance to the bone where it kind of veers off like that, you're actually looking at something a bit more acute. So this would be kind of a, you know, like with an adult, you get a fracture of the neck of femur. This is as close as you get to a fracture of the neck of femur, but for peds. And I guess that would be like Salter Harris, SA. It would be like a slip, isn't it? So this would be like a slip of the slip between the two. So this is actually an acute injury. They had, you know, quite a high traumatic event, and that resulted in that break, that slipping of the growth plate, as you can see in that kind of the curved appearance of that cortex. What tells you that this is not like something that's happening over time. This happened quite acutely. So it's actually an acute injury, which is why I thought it'd be quite useful to show you. And I don't know, this view might be, I don't know, some people might not be convinced, but when you look at this view, can you see like how everything's kind of curved off in the wrong direction? It's not as though like you've got a bit of, you know, normal looking femoral head. This whole thing has just sort of veered off towards that side because there's been such an extensive injury. Right, so I think that's quite an interesting case, that one. I don't normally see that when I found it that first time.